Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Welcome to Dr. Nancy RN. Healthy world, healthy nation, healthy you. I'm Nancy Valentine, registered nurse and PhD. And we have a healthcare show today that I think you're going to find very interesting, because I think every one of us has asked ourselves, when we go to the doctor, what do we expect? Don't we expect the doctor to do everything for us? That's really why we go, why we pay the fee. The other thing that we often do is we complain about healthcare costs. I don't know anyone that isn't complaining these days about the rising healthcare costs. But our show today is really going to tackle both of those questions and issues by using a term which many people really are not familiar with. So the name of our show today is Patient Engagement, a marriage between what the doctor ordered and your healthy choices. And we have an expert nurse with us today who's going to tell you about how this actually is going to work in your life. So I'd like to introduce Nurse Marty Minetti, who is our guest today, and I want to tell you a little bit about Marty and her background. Marty is a graduate of the Bryn Mawr Hospital School of Nursing, and then she got a degree in psychology at Rosemont. She then was a candidate for a master's degree at the University of Pennsylvania in organizational dynamics. Now, Marty is a dynamic nurse, and you're going to find that out today in our discussion with her. She is a very entrepreneurial person who has put together multiple businesses. And today her role is Senior Vice President for Product Development, creating tools that patients and doctors can use to really help us do a better job with navigating through all this healthcare reform. In addition to that, for the past 33 years, she has been the Chief Executive Officer of her own company called Skilled Nursing, Inc., SKI. And they do staffing and search for nurses to get the best nurses into roles and responsibilities in hospitals here and throughout the United States. So welcome, Marty, and thank you so much for being with us.
Thank you, Nancy. Nice to be here.
Thank you again. Well, I want to tell you about the 3 key points that Marty is going to address with us. First of all, with this whole idea of patient engagement, we're going to define the term so that at the end of this program, you will know what patient engagement means. The second is we're going to talk about the benefits of patient engagement to you and your family. And they are principally better quality of life and how you can have a role in saving money. And then thirdly, we're going to address the new healthcare laws that are coming down the pike, ones that are going to build on the healthcare reform changes that we already have, but are going to take them, next steps. And they have implications for both your health and your pocketbook. So it's always good to know what's coming. And Marty, that's why we have you here. So really educate us about this role of patient engagement, which is spoken about in the healthcare bill. But most people, as I said in our introduction, really don't know what that term means.
And that's correct, Nancy. Patient engagement is really about patients getting much more involved in their own care and not expecting the doctor to do it all. You said it right in the beginning. It is true, we go to the doctor, we expect to get a prescription, we expect to be cured. And when we look at problems like diabetes or asthma or hypertension, some of the problems that 30% of the population have, we now know you can't do it just with medication. You have to make some lifestyle changes. And so our government now has become very clear, our experts, our healthcare experts have become extremely clear that the providers, the doctors, the nurse practitioners, the physician's assistants, they can only do so much. In the end, a lot of the equation in terms of outcomes, how good we feel, how our quality of life is, how long we live, and also what we're paying out of our own pocket has to do with our behaviors. So this isn't about being super strict, it's more about normalizing what's normal.
Mm-hmm. Well, how are people going to actually do that? I mean, most people will say, okay, I do something for my health, but is this going to be more rigorous? I mean, what are people going to have to do?
A lot of the changes that are coming are really about increasing the communication between the physician or the nurse practitioner and the patient. And to give you an example of that, we know that when patients are at home, let's take a diabetic, they might have a blood sugar one day of 300, and they think, oh, I'm not going to tell anybody about this today because maybe by tomorrow it'll be fine. Well, now the requirement is really that we begin to talk about those things, or we use some type of tool to communicate to our physicians to let them know. And the reason is, you want to get to a problem as soon as possible. If you do that, you increase your chances of really not having a negative event, meaning not going to the hospital, not having a worse condition. So we're starting to see, for example, our scientists are now saying we need to have data from patients, something that we didn't do except for drug trials before. So patients are going to be asked to provide information by computer, by mobile, in the doctor's office, by surveys, different ways of getting information from patients to understand how are you really doing. If you're having a problem, you can't afford your medications aren't working, perhaps the medications are making you sick. These are important things the physician and the nurse practitioner need to know.
Right. But do you really think that the stage has been set for this, Marty? I mean, I'm thinking about, communication in general is a two-way street. So if we're asking patients and families to do more, what are physicians, nurse practitioners, other members of the treatment team doing to facilitate that discussion? Are they encouraging it? I mean, typically you can go to a very good doctor and they will not really get very much into what happens after you walk out that door. They'll just give you the scripts, they'll maybe explain what this illness is, and just, basically tell you to call if you have a problem.
I agree, and this is one of the barriers that we're going to have to overcome. I have a visualization I wanted to just show a picture of.
Okay.
Because I think when your audience sees this, they'll be able to understand a little bit more about how important patient information is. So you're right, today you go to see the physician or the nurse practitioner, they maybe have 10-15 minutes with you, if you're lucky 20 minutes. And they have to get a certain amount of information from you. There's not a lot of opportunity for dialogue. But what we know now, if you look at this visualization, you'll begin to see in this pie graph, there's a big section of information missing. What's going on for you at home, how you feel every day, what your various blood pressure or blood sugar might be. And so part of what's happening is we're using tools. We're so used to going to the ATM, we're so used to using our smartphones or our cell phones. We're using those same tools now to get information from you as a patient. So for instance, I might send you a message today to say, Nancy, what's your blood sugar? And if your blood sugar is normal, there's no need to do anything. But if your blood sugar is higher or lower than normal, I now have a piece of information to help you. And ordinarily, most patients would not call their doctor unless they were way out of range. So they're the types of things we're doing to increase the dialogue. In scientific terms, we're providing data as patients to help manage care.
Right. Well, I heard you say a couple things, Marty, that I think are really important to sort of walk through. One is it's not just information that you would give when you are in that office or you're in the clinic. You're talking about ongoing surveillance, where there is an ongoing communication, either through telehealth, telemedicine, some kind of emailing. I mean, there are all different methods that are going to be used out there, but that implies also that you're checking your blood sugar every day. So, I mean, it's not just a reminder to do it, but you really then, as the patient, would have to then give back the information. Yes, today my blood pressure or my blood sugar, whatever was being measured, is normal. It's within normal range, which also means that the patient and the family really have to have a better understanding of their numbers. They need to know what these numbers mean. They need to know how to interpret that. And all of this, I think, we have sort of left to the professionals. So when you think about those 15 or 20 minutes, how do you envision people sort of getting on board with this? I mean, one of our other wonderful speakers spoke about medical home, that medical homes are going to be crafted to take in this kind of information. How do you think people are going to recognize that this is a whole new world?
So I think what you're bringing up is very important. I think what we're seeing today is, you're talking about patient-centered medical home. So patient-centered medical home is really, to me, old-fashioned medicine with a new twist. It is the patient and the doctor or the nurse practitioner, whoever it is who's your primary caregiver, really working together to get you to a better state of health. We know that patient-centered medical home, as an example, decreased healthcare costs by 30%. That's a huge number. That's huge. So in regard to how the patient gets in the game, first you have to understand what the goal is. So when you were talking about surveillance, in this case it's more connectivity. We need to be more connected. We're so connected in everything else in our life, but in regard to our health, maybe not as connected as we need to be. So it's this idea that I as a nurse or you as a nurse know what's going on when the patient's at home. And in terms of numbers, it's always amazed me that patients or the people know so much about their cars, but they don't know that much about their bodies. So this is a step-by-step process. Rather than trying to teach somebody how to be a medical professional, we just need to teach somebody a few things. For instance, if you're a diabetic, this is what I want you to tell me. What's your blood sugar every day? What's your feeling good score every day? If you're not feeling right, it means something. And you have a chance to observe yourself and see, am I just off today? Or is it something more significant? The same with blood pressure. What is your normal blood pressure? What medications do you normally take? These are things you would never think of getting into your car without the right paperwork in case you were stopped. Yet, people go to the hospital without their medication list. They go to the hospital without a list of their problems or their conditions. And so there's this communication gap on what is my role as a professional and what's the role of the patient. And we do have to be in the game together. We do have to be on the same team. The fact that we're not on the same team right now is a good piece of the cost.
Right. Right.
And it's huge.
Well, I think Marty has made some really excellent points, and I think it's going to be a big behavioral change for people just to get all that organized. You know, to really have all of your records organized, to really know what your numbers are, to keep that dialogue going so that your appointments are really just check-ins. They're not like a whole new event. Like every time you have to sort of go over the same material and sort of catch up with where you are. The catch-up is going to become an ongoing situation for most chronic conditions.
I think you're absolutely right. We're working, we have a study that we're doing that's with a patient-centered medical home practice down in Philadelphia. And it's also with IBM, who's one of our partners. And it's an interesting study in that we are connecting to patients at home. And that data is coming into reports that go into the actual practice. So by the time the patient comes to see the doctor has a report not only from lab results, but from the daily reports of blood sugar or blood pressure at home. So now you have this whole new section of information. And I think they're the kinds of things that, yes, it is a behavior change, but it's like anything else. We learned as a country to use ATMs pretty quickly. We certainly know how to order at Wawa very quickly. And I think we're going to see the same thing. We're going to see patients adapt because they do want to get better. And they want to have a little bit more control. The other thing that I'm seeing is, as a public, we like incentives, and you're starting to see employers and health insurance companies begin to incent people. And sometimes it's just moving the needle a little bit. You know, are you getting closer to your normal weight? Have you decided to try a smoking cessation program? Have your blood sugars been in a normal range if you're a diabetic? All of those things are beginning to be reviewed and looked at in terms of whether or not you're a good patient. For lack of better words, it's almost like the car insurance. Right. You know, if you had 3 accidents last year, your insurance is going up. But if you're a safe driver, your insurance goes down. And now, in terms of healthcare, we're starting to see the same thing. Are you doing what you can do? Now, not the impossible, but what you can do. So this isn't about a genetic disorder. This is not about having a traumatic accident. This is about things you can do on a daily basis, and are you doing them to be as healthy as you can be?
Right. So back to our first key point in terms of the definition of patient engagement. Patient engagement is really working in a partnership with your treatment team, your doctor, your nurse, and really having actions that go along with that. So it's not really being the passive recipient of just a prescription or just some direction that you may or may not even understand or follow when you get home, but that over time you will be asked to really keep track of and report back on what these things really mean and how they really assess your well-being. So I think that's, for better, it's not a dictionary definition of patient engagement, but I think it gives some idea of what the actions are that really is going to constitute patient engagement.
You know, you did a very good job. This is patient engagement is about just getting much more involved, connecting more, beginning to talk about what you need as a patient. One of the things that we've learned, which is very interesting, is a lot of times when a patient is with a physician, no matter how wonderful the physician is, the patient won't ask very many questions. They'll just shake their head up and down that they understand something. And again, a lot of us are very busy, we're in a hurry, we're thinking about home or whatever we have to do or work, and so the tendency is to get in and get out. Yet when we give the patient a kiosk to answer some questions at the end of the visit, they'll tell you if they feel competent to manage their medications. They'll tell you if they can afford their medications. They'll tell you, do they take them regularly or not? And that's important because if a patient's not taking their medications, we actually need to know. And then we need to find out why. Maybe there's something we can do to help them.
Well, tell us what that entails. You said when we give people a kiosk at the end. I mean, in any doctor appointments that I've had, I've never seen a kiosk, or no one's ever asked me any follow-up, questionnaire, pencil and paper, or no one has really called me to ask me those questions. Is that what we're going to see?
You are. This is the beginning of the shift that we had talked about before the beginning of the show. There's definitely going to be a shift to more technology in offices. You're going to see kiosks at the front of the office visit, at the back of the office visit. You'll see more iPads. You'll see more mobile phones being used or smartphones being used. And the whole idea here is to get information from you as the patient that the physician or the nurse practitioner can use to help you. It's also a good way to include your family, because with some of these systems and some of these new tools that are being developed, you can have a primary caregiver in your family. So this might be a son or a daughter, or it might be a sister that you trust, who really is the keeper of all of your medical information if you should ever have an emergency. And these are, again, very important aspects. In daily life, we do certain things to take care of our car and our home and have our paperwork in order. Now we're coming into healthcare and saying we need to do the same thing for healthcare. We need to be prepared.
Right. Well, I think it would be really interesting to have a show on all the technology that is going to be thrown at this, really. And I think that the point that was made is that we've got technology, and there are learning curves for many people with the technology of just how to use these smartphones or how to use your computer to its maximum effectiveness. So I think we're going to see the same thing, and I'd like to further discussion about that. Maybe if you would come back and talk with us about that, that would be great. But I think in terms of this whole definition of patient engagement, one of the key points is that this is going to help you. It's not really just for the doctor's benefit. This is really ultimately for you. The partnership is all around you and healthy you and making yourself healthier. So tell us about this quality of life and also the economics of it. How will this help people feel better, and how will they potentially save money?
So there's been a number of studies that have been done in regard to patient engagement, and what is clear is patients that are engaged, who understand more about their health care, go to the hospital less frequently. It's about 17% less. They also play a big role in their own safety. Because so many people are involved in healthcare, you might be seeing a cardiologist, might be seeing primary care, might be seeing a diabetologist. You start seeing numerous providers. It's very easy for a slip or a miscommunication to happen. People that are engaged in their own care have 37% less communication issues amongst providers. So they actually help keep the information straight. Because if you go to the doctor today, if you happen to go to a specialist versus primary care, you know what's going on. Your primary care physician doesn't know that yet. So you're actually the expert yourself. And in regard to overall cost, because the quality of life is improving, meaning that you're in more control of your health, you don't have as many problems, the cost is about 15% less per year. And that is a significant number. Most of us are paying a significant amount of money for life insurance and health insurance, and both of those come into play.
So let's go back over those figures again. So you're saying that if people are engaged in their own health care, they tend to go to the hospital 17% less frequently.
Correct. 17% less time in a hospital. And it is because they're managing themselves better.
Right.
They don't need to go to the hospital. They're alerting the physician or the nurse practitioner ahead of time. My blood sugar's up. So let's handle it today. Let's not wait till it's out of control and I have to go to the ER.
Right. And that's really a very good lesson learned here as well, because many of these chronic conditions, people wind up being rehospitalized for relatively minor issues. They really have to do with spiking in your blood sugar or spiking in your blood pressure, or being dehydrated among elderly people, and that can cost a 2-3 day hospital stay just to get that stabilized. Whereas if you're stabilizing at home on an ongoing basis, you can really avoid that hospitalization. So 17% is a significant number this early in the game.
Correct, and it will improve. You're right, it's going to grow more, and I really think and it has nothing to do with age. I think that whether someone's in their 80s or their 90s, they will absolutely begin to see this kind of new role emerge, and they will say more about what is going on with them. So. Not going to the hospital, not having as many physician visits. I mean, you do have to have physician visits, but not as many. And again, handling everything as it comes up. So not waiting to the last minute, not waiting till you feel terrible.
Right.
Because those things, you're always out of the gate too far, and then you have to kind of go tuned up, whether it's the emergency room or the hospital, or even multiple physician visits.
Right.
So that is the goal. And it's interesting, Nancy, even with right now in the hospital industry, if some patients are readmitted within 30 days of certain problems, congestive heart failure is one that comes up all the time, that hospital gets no money for that readmission. They're actually penalized for that readmission. So again, when that patient goes home, it's incumbent upon the patient and the family to say if something is not going well. And when we talked about tools, this is a place where you're seeing a lot of tools come into being. So we know on a daily basis, how is that congestive heart failure patient doing? And I've had patients say to me, well, why do I care about this? I care about myself, but why do I care about it for other people? And my answer is, you're paying for it.
Right.
You are paying for it, and you will continue to pay for it, because whether we like it or not, we're all connected. And so the more we move the needle, the healthier we get, the better it's going to be.
Right. But I think it's really important to make that distinction between this is not less health care. This is better health care, and less frequently, because you are in control of how you are managing yourself in a much better way, which really is a win-win for everyone, because people do not want to wind up in emergency rooms or in hospital stays that could be avoided, and that's what we're really talking about.
Correct.
If you need it, you should get it. You absolutely have to have it. But if you can manage this more effectively so that you can bypass that, that's a win for everyone.
It's a win for everyone, and from an economics perspective, the truth is it's less out of pocket for the patient and for their family. And so again, the more we're managing, it's like taking care of anything. You take care of your car, your house, your children. Now it's time for us to take care of us.
Right, that's a good point. And then in terms of people, when they're informed, they really have 35% less encounters with asking a lot of questions. I wasn't sure I really understood that particular statistic.
It's 37%. So here's what happens. Let's imagine that today you go to the cardiologist this afternoon at 4 o'clock, and the cardiologist adjusts your medication. With our systems today, your primary care physician does not know that. You go to see your primary care physician, let's say a week from now, and you happen to be going over medications, and there he is, your physician's going over your medications, and he says what your old cardiac medication was. And you go, oh no, that was changed last week. This is my new prescription.
Right.
You have it with you, you're bringing him up to date. Now eventually, as a society, we will all be linked up electronically, and that information will transfer electronically. But that's going to take years.
Right.
So right now, you're the best person to have that information, have it on a piece of paper, and be able to communicate that to your physician.
Right. I think that alone is a big switch, because people, again, depend on their doctor to have the latest information, and that may not be possible that you really then become the conduit of that, and that you are the one that's really the spokesperson, the self-advocate for your own health, and you're able then to lead your physician group in many ways. I think the last statistic was on what? You have to refresh my memory.
It was about the emergency room again. It was really keeping the patient out of the emergency room.
I see.
But in terms of quality of life, what we do know is that you are going to extend your quality of life. You're going to pay less out of pocket. The economic value is about 15% per year.
Right.
Which is a significant number.
Right.
Plus, remember, every year your insurance costs right now have been going up. They've been going up for the past few years. And so that tells you something. I mean, as a country, as an overall population of health, we know that we've got problems and we've got to fix it. And this is one of those problems where the Americans have to fix it themselves. We really need to just make a few adjustments. It's not hard.
Right.
It's we have a program that we talk about which is called a 1% improvement per day program. So an example would be, let's say you normally walk up and down the steps to your home in the morning and at night, not
Right.
too much in between. Well, you know, if you do it an extra time or an extra 2 times, that's a little bit of strength training. And the idea is just keep going. Do a little bit more each day.
Right.
Maybe eat a little bit better each
Right.
day. If you're a smoker, and there are still many smokers around and many young smokers, which, you know, breaks my heart to tell you the truth, I look at that and I say, how can we help people understand this is so damaging to you?
Right.
So let's get you into a smoke cessation program.
Now, our third key point that we were going to end with is a discussion of some new laws that are coming down the pike. So give us some information on that.
Correct. So everybody knows about Obamacare, and there's been a lot of people who see it as positive and people who see it as negative. But the truth is that what is starting to happen is we're starting to understand that there are many people in this country who need care who don't have care. And somebody has to pay for that. And so right now, all of us as taxpayers are going to pay for that. Well, how do we balance all that? We balance it by, in fact, beginning to get people, take the people that are healthy, keep them healthy. If you're not as healthy as you could be, okay, let's try to get you a little healthier. If you have a chronic condition, then let's begin to help you manage that condition better. And at the end of life, which is a subject that is very difficult for people to talk about, when it's time, it's time. That does not mean there's going to be, I forget what they called them in Washington.
Death panels.
Death panels. Don't believe in anything like that whatsoever, but I do believe that there is a time when people will say enough is enough. I don't want to do this anymore. And that's where hospice, which is totally underutilized, is really of value.
Right.
So the rules or the laws that I see coming into play are more about what is going to happen on the provider side, what can be used as incentives on the provider side, and we're already seeing that. There's these new legal formations for doctors and hospitals to work together and payers. And then on the patient side, or the employer side, what can we do to incent people to be healthier? And we're starting to see more rules. I mean, we know that insurance companies, as an example now, since Obamacare was passed, can only make a certain amount of money. So they either spend money on care or they give money back.
Right.
And so you're starting to see a whole new dynamic happen in terms of, again, the measurement is very simple. Are we healthier this year than we were last? Are we healthier compared to most people in the nation? And right now the answer is no. So we've got some work to do. And this is where I think the American spirit and the pioneer spirit comes in. I think we pick ourselves up by our own bootstraps and we start fixing things.
Right.
And the biggest place is really connecting with that physician, that nurse practitioner, taking just a little bit more accountability.
Right. There's been a lot of pushback in some arenas where people are getting penalized, but if they're smokers, they have to pay more, or if they're obese. I mean, we've seen a lot of that in the public press, but I think what Marty is telling us is that these are realities, and that as we really try to help one another, which is really the goal of this program, is really to help one another, to be more effective and really be a cheerleader for one another to get healthier, because it really is, as we've been talking about today in this show, it's a win-win for everyone. Well, I want to thank you because I think what we've really done is we have met our goals. We've talked about patient engagement. We've talked about how as we get engaged, we will really have a better quality of life. We will save money. And I think thirdly, we have to be astute and realize that there are further laws coming down the road that are going to have incentives built into them so that the healthier you are and the more you work at it, you will have to pay less. People who are unable to do that, really unable to engage in these kinds of programs, such as weight reduction and smoking cessation, they will have to pay more because they are draining more of the cost of the healthcare system. That is a very, very big change for us in this country, but it's something that we really are going to have to grapple with. So I want to thank Nurse Marty Minetti for her discussion with us today, because Marty is in a different world than a lot of nurses. She is working in a product development world in a company that is providing services to hospitals, to clinics, to physicians, ultimately to patients. And so she's really got a business hat as well as a clinical hat. And I want to say that I think that that is to be admired, Marty, that you've been able to use your clinical skills and your devotion as a nurse to really help to build stronger businesses and better tools. And she has promised that she's going to come back and do a show to really tell us about what some of these tools are and what you are actually going to have in hand to help you become a better engaged patient. Thanks again, Marty, for being with us, and thanks again for our audience for tuning into the show. Have a wonderful day. I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening, and join us again. And remember, with health, all things are possible.